for all. And that's what makes me proud to stand here today and to stand here in the state of Illinois to my gratitude and appreciation of the magnitude and the momentum that we have in legislation that's been written throughout the last year and a half to truly change lives, to truly change communities. Legislation most recently passed and pushed through related to the momentum to extend postpartum care for women, to help further link them into the healthcare system for their clinical needs, mental health needs, and social service needs. The legislation of this past year and a half brings forth final changes that we've been fighting for decades. And to be frank and direct, this legislation is well overdue to help the people whose voices have been left behind for so long. So it is my gratitude and appreciation for our local elected officials and for our governor for what they've been able to accomplish over the last 3 years as a renewed start in the hope and well-being of our community and our citizens. I would like to welcome to the podium Governor J.B. Pritzker with just a simple note. And that note is thank you. Thank you for your leadership, and thank you for making the state of Illinois, under your leadership, the advancing state of making change in the health outcomes, health status, and health care in the United States of America. Thank you.
Well, thank you so much, Larry, and thanks to everyone for joining us today. I want to personally congratulate Touche Hospital and Southern Illinois Healthcare Foundation and many other local collaborators on being among the first 8 awardees for healthcare transformation funding. I hope to be back here again and again and again to celebrate your successes in health equity. I'm here today with Lieutenant Governor Juliana Stratton and Illinois Healthcare and Family Services Director Teresa Eagleson to mark a milestone in our effort to make healthcare more accessible and more affordable for all the people that we serve. I want to recognize Senator Cristina Castro, who could not join us today, and Leader LaToya Greenwood, who is here with us, for their impact on this effort. These 2 leaders shepherded through the General Assembly the Improving Healthcare for Pregnant and Postpartum Individuals Act. They committed themselves to ensuring that Illinois continues to be a leader in eroding racial disparities in healthcare coverage and increasing access for women and babies. I'd also like to welcome their General Assembly colleagues and my friends, Senator Chris Belt and Representative Katie Stewart. And while she couldn't join us today, I want to offer recognition to Representative Robin Gable for all of the healthcare programs for women that she has humbly championed behind the scenes in the General Assembly. I'd also want to thank the advocates for their work to support and meet the needs of pregnant and postpartum individuals all across our state. Planned Parenthood, EverThrive, the Shriver Center on Policy and Law, Illinois Contraceptive Access Now, and the Illinois State Medical Society. They have been invaluable partners, and I'm proud of the work that we've been able to accomplish together. I also want to thank those doing the important work directly with mothers and mothers-to-be and patients, such as organizations like Sweet Potato Patch and practitioners who work in OB like nurse practitioner Donna Myers. Earlier this year, Illinois proudly became the first state in the union to offer eligible mothers 12 months of postpartum care coverage through Medicaid, an extension of my administration's work to reduce health disparities in communities across the state and improve maternal health outcomes for women of color particularly. And today, I'm proud to announce that thanks to recent federal approval, we're extending that maternal and prenatal coverage for all legal permanent residents and undocumented residents, ensuring that ours is a state that looks out for all who call Illinois home. This new law rightfully enhances those benefits with a whole health approach, including providing for prenatal depression screening under Medicaid during the entire year following pregnancy, adding language translation and nurse home visitation to the list of reimbursable services, and at the recommendation of the Infant and Maternal Mortality in African Americans Task Force, expanding covered postpartum providers to include doulas and certified midwives. And we're ensuring our values touch private insurance as well, with new requirements for private coverage to include postpartum services like mental health and substance abuse disorder services. What's more, this law ensures the latest in maternal mortality research is reflected throughout our state agencies, amplifying our focus on high-risk pregnant and postpartum women at all relevant programs, with a keen eye for mental and emotional wellness too. I'm very proud to partner with the General Assembly to shape a whole-of-government approach to making Illinois a national leader in advancing and protecting a woman's right to choose. From establishing reproductive rights as fundamental rights to making prescription birth control directly available at any pharmacy, we are affirming Illinoisans' control over the most personal decisions of their lives, with access to the care that they need and deserve along the way. With that, I'd like to turn it over to a true champion for a more just healthcare system in Illinois, and someone I'm very proud to be partnered with in governing this state, Lieutenant Governor Juliana Stratton.
Good afternoon, everyone. Thank you, Governor Pritzker, for the warm introduction. It's always a pleasure to stand with you as you lead this state with courage and compassion. And it's so great to be here with the advocates and elected officials steering our state in the right direction. I especially want to acknowledge the sponsors of Senate Bill 967, Leader LaToya Greenwood and Senator Christina Castro. You know, as a proud mother of 4 daughters, I know the joy that comes with bringing a new life into this world. But far too often, pregnancy can be life-threatening if new parents don't have access to essential healthcare services. The United States is a wealthy nation, yet our maternal mortality rates are among the highest in the world. In Illinois alone, there is 1 pregnancy-related death every 5 days, and more than 4 out of 5 of these deaths are preventable. And Black women are most likely to die, laying bare the devastating impacts of intersecting racism and misogyny in the healthcare system. This is a public health crisis, and we must be bold. That's why we're here today to celebrate and highlight the signing of Senate Bill 967, the Improving Healthcare for Pregnant and Postpartum Individuals Act. It is another important step toward ending the crisis in the state of Illinois. As chair of the Illinois Council on Women and Girls, one of our top priorities is combating the inequities that stand in the way of wellness. And this legislation addresses each of our recommendations to ensure high-risk pregnancies are treated with care and the attention that are essential, not just to survive, but to thrive. I'm so proud of the work that we're doing to make Illinois a model for the nation when it comes to providing affordable, accessible health care for all. And with that, I am so proud to do it alongside tremendous change makers like our next speaker, Leader LaToya Greenwood.
Thank you, Governor Pritzker and Lieutenant Governor Juliana Stratton. Good afternoon. Over the past year, we have taken significant steps to improve healthcare outcomes for women, and this new law will assist in the effort by expanding maternal and child health coverage and addressing racial disparities that have plagued too many communities for far too long. Senate Bill 967 is the result of recommendations from the Illinois Department of Public Health's 2018 and 2020 reports on maternal mortality and morbidity. These reports emphasize the sad and unacceptable reality that a mother's skin color correlated to increased pregnancy-related health risks. As the pandemic has underscored, these health disparities are real, they are tragic, and they required a response. Under Senate Bill 967, we will target preventable deaths by many of the things we've already heard stated by Governor Pritzker and Lieutenant Governor that are inside the bill. I am thankful for the tireless dedication and years of commitment from advocates who are with us today to bring us to today, and I am grateful that we have a governor who shares our vision and has been a partner in delivering needed reform. Illinois should be a leader when it comes to maternal health care, and I am hopeful that this collaboration we saw on this piece of legislation will continue as we move toward our goal of ending pregnancy-related death here in our state. I thank you, and I will bring up my colleague, Representative Katie Stewart.
Thank you. It is such an honor to be here today, and thank you, Governor Pritzker and Lieutenant Governor Stratton, for coming to the Metro East to be here to talk about this important legislation. It makes me so proud to be a member of the General Assembly, to be able to work on legislation like this, shepherded by my colleague, LaToya Greenwood, who I'm always honored to work with day to day, sitting next to each other in the Capitol building in the wonderful chamber where we get to represent our area. Making Illinois a leader in the maternal health space, protecting mothers and babies is the most important work that we can be doing. And I'm just so thankful that we were able to pass this legislation. We couldn't do it without the work of the collaboration of all of the shared partners that we see here today. So I just wanted to say thank you to everybody. And it is my honor to be able to introduce next Director Eagleson.
Thank you, Representative, and good afternoon. As Director of the Department of Health Care and Family Services, I'm very pleased to be here today and to talk about the recent legislation advanced by Leader Greenwood and many of her colleagues, as well as this administration's commitment to the health of women and children who depend on Medicaid for their health insurance. I'm so proud to work in an administration that recognizes how vital health care is for everyone, and to have partners in the General Assembly who are motivated to pass laws to improve healthcare quality and equity across our state. As people have said, disparities in birth outcomes for women of color, especially for Black women, remain far too wide. And the legislation we're celebrating today really works to reduce those racial disparities in health outcomes as it expands postpartum services. It provides a level set that will positively affect if a woman is getting services for, say, depression, or even if she's ditched opioids through medication-assisted treatment during her pregnancy, that she can continue those services well past her pregnancy as she's trying to raise a new little life. There are also Medicaid-specific changes like lactation consultants and other help and family planning services to improve outcomes for moms and babies. As the governor said, also, I'm extremely proud to say Illinois had sought a federal waiver to extend postpartum coverage from 60 days to 365 days, and we're the first state in the nation to be able to do that. We continue to lead the nation in implementing equity-centric healthcare improvements to improve lives. The governor also congratulated the collaborative here, and I want to add my congratulations to that. All these efforts build on a lot of years of important policy work and data analytics from a dedicated team at HFS, and we're grateful to you, Governor Pritzker, Lieutenant Governor Stratton, and members of the General Assembly for your consistent support and guidance in our mission to reduce healthcare disparities across the Medicaid program. Thank you very much, and I'd really like to introduce now Dr. Donna Myers from Southern Illinois Healthcare Foundation.
Good afternoon, everyone. I'm very excited about this legislation and what it's going to bring to the state of Illinois for postpartum women and for women of our community. So what does the change mean to me as a women's health provider in the state of Illinois and a provider in this community? Improved health care for our postpartum women throughout the state. Continuity of healthcare. So no longer will providers as myself worry about having a patient not have proper follow-up care past the traditional 60 days, such as our old insurance coverage provided. I won't have to worry about that woman who had preeclampsia and postpartum eclampsia getting the adequate care that she needs. Patients will now have the opportunity to receive quality health care for management and treatment for these and other conditions that affect mainly women of color. Did you know that 50% of women with gestational diabetes progress to type 2 diabetes within 5 years after that initial diagnosis? So this bill will change and provide care that this woman will receive. Providers won't have to worry about this woman getting proper monitoring, treatment, and not even being able to get her insulin and other medications that she needs. No longer will us as providers have to worry about the effects of untreated diabetes on this patient. Senate Bill 967, what does it mean for our postpartum women? It means 1 out of every 7 postpartum women experience some sort of depression within the first year after delivery. Postpartum women in Illinois and women in our community will now have medical access to care for postpartum depression. So no longer will they feel that they have to battle this illness by themselves. Senate 967 also means continued family care past the traditional 60 days. Now postpartum women will have adequate medical care for pregnancy planning. This waiver will benefit not only the patient but also the community. We will have interceptual care and education provided through this Senate. Domestic violence in pregnancy is very common. And guess what? It does not go away after delivery. Extending the length of the postpartum insurance coverage will afford more time for screening of victims by a medical professional and also give that postpartum woman more time to maintain that bond between the healthcare provider and her as the victim. This will hopefully make them feel more comfortable and trusting about their medical care provider. Senate 967 is such a great piece of legislation. This extension gives postpartum mothers an increase in medical coverage. Increase in medical coverage for screening and management of illnesses such as preeclampsia and postpartum preeclampsia, and diabetes, hypertension, heart disease. It increases opportunities for patient education. It offers referrals and linkage of care. This Senate also closes the gap care for postpartum women who may have missed that first 6 to 8 week postpartum visit. Now they have a year. The extension of medical coverage ultimately would decrease health disparities for all postpartum women in the state of Illinois, and especially for those postpartum women in our community. I only wish that other states recognize the need and importance for such a change. Thank you. I would now like to introduce Dr. Nicholson. Dr. Nicholas.
All right. Good afternoon. My name is Dr. Kelly McNicholas, and I'm the Chief Medical Officer for Planned Parenthood of the St. Louis region and Southwest Missouri. I first want to start by thanking Dr. Myers for her commitment to this community and caring for the pregnant folks who exist here. I also want to thank all of those sitting behind me for your support in SB 967. This act is a sound healthcare policy that will have measurable impact on infant and maternal mortality rates and offers hope for a real strategy to tackle the health disparities, especially among Black and brown families and people of low incomes. Planned Parenthood's health center, just a few miles from here in Fairview Heights, serves more than 6,000 patients a year, more than a quarter of which live here in St. Clair County. Our patients come to us for birth control, annual screenings, STI testing and treatment, as well as pregnancy planning and preconception care. We know that optimizing health before, during, and after pregnancy is one of the most important things that we can do to help support healthy families. Yet every day, we see patients without adequate health insurance or other financial resources that are instrumental to succeeding in that goal. Expanding Medicaid coverage and instituting private insurance mandates will have long-lasting impacts, not just on an individual patient's health, but on the health of the family unit and the health of a community. From mental to physical health, this policy will save lives. We as providers are watching a maternal health crisis unfold before our eyes. It is an epidemic within the COVID-19 pandemic. Like many frontline healthcare professionals, reproductive healthcare providers know we cannot alone solve these compounding problems. We need public and private partners, policymakers, and leaders to help us dismantle systemic barriers that continue to disproportionately harm our most vulnerable communities. I often say, patients are the experts in their own lives and of their own bodies. Each of them deserves our support and resources to ensure a healthy future. I'm hopeful that together with policies like SB 967, we can start to chip away at the maternal health crisis in our community, in the state, and across the country. I next want to welcome Katie Theody.
Hello, thank you so much. It is an honor to be here today representing ICAN, an initiative to advance reproductive equity by improving the quality and coverage of contraceptive care. ICAN stands for Illinois Contraceptive Access Now, and that is exactly what SB 967 will mean for tens of thousands of Illinoisans in need of family planning services without financial barriers. Today, 1 in 4 reproductive age women in Illinois still have an unmet contraceptive need. We estimate that in the first year of implementation, the Family Planning Spa will help 70,000 individuals gain access to contraceptive care and related services. This will be an essential step towards addressing the profound inequities in maternal and reproductive health experienced in BIPOC and low-income communities who are now also contending with the most devastating effects of the COVID-19 pandemic. While we celebrate the passage of this crucial piece of legislation today, we have not yet crossed the finish line. ICAN will continue to work closely with HFS leadership to ensure the Family Planning Spa delivers on its promise of creating a more equitable Illinois. I want to thank my CARE Coalition colleagues for their tenacity in advancing this critical legislation. And finally, I want to appreciate Senator Castro, Representative Greenwood, and Governor Pritzker for their leadership and commitment to reproductive rights and justice. At a time when other states are enacting egregious, racist laws to police birthing people's bodies, you are leading Illinois forward to a more just, healthier, and equitable future. Thank you. It's now my pleasure to introduce Stacey Miner.
Good afternoon. My name is Stacey Miner, and I'm the CEO and founder of Sweet Potato Patch Chicago, but we're all over the state of Illinois. But I want to just say quickly that we started Sweet Potato Patch because I grew up in a food desert and currently live in a food desert, and there just weren't enough grocery stores. But to dig deeper in the work and partner with Southern Illinois Health Foundation and hear about preeclampsia and how so many mothers are there's so much maternal mortality out there because of these issues. I just wanted to get back to getting people access to healthy food. There's so many dialysis centers in our community and not enough grocery stores. So we wanted to bring healthy food right to the doorstep of people in those communities. And so to be able to do this and now lead to legislation that can help pregnant moms be healthier and help more healthy babies is great. We have a healthy baby here that's a part of our program, and I'm super proud of that. That's our win, right? So thank you for this legislation, and I also want to thank the governor and Larry just for being behind this health push in Illinois, and let's keep Illinois great. Now, I'm going to reintroduce our esteemed governor of the state of Illinois so he can answer questions.
Thank you. Happy to answer any questions from members of the media.
Do you want to address the COVID hospitalizations in Southern Illinois?
Yeah, I'll just take a moment to remind everybody how important it is that everybody get vaccinated, that we wear masks indoors. At this moment, we have, as you know, and has been widely reported, there are 0 ICU beds available across Region 5 of Southern Illinois. And although we are providing staffing and making sure that if someone does show up at a hospital that they can get cared for, that is only available to us on a limited basis for a limited period of time if people don't take seriously the mitigations that we need to have in place, and that we bring down the infection rate. So I want to encourage everybody to do the right thing. Make sure you encourage your friends and family to be vaccinated. It is safe, it's widely available, it'll keep you healthy, and of course making sure that our kids are masked in schools, especially those who can't get vaccinated, is a very important part of keeping our communities healthy. So thank you very much for joining us.